The term cardiomyopathy is a general term that refers to the abnormality of the heart muscle itself. Out of the 4 types of cardiomyopathy, the most common is a dilated cardiomyopathy, also known as DCM, a condition in which the heart's ability to pump blood is decreased due to the enlargement and weakening of the heart's main pumping chamber, the left ventricle. DCM may not show any signs or symptoms at first. As time goes on, the muscle dilates and weakens. As a result, there is risk for stroke, heart failure, and heart attack. Signs and symptoms of this illness coincide with those of heart failure, including fatigue, shortness of breath, swelling in the legs, ankles, and feet, swelling of the abdomen due to fluid buildup, chest pain, and extra or unusual sounds heard when the heart beats. Dilated cardiomyopathy can be inherited, but it is primarily caused by other factors such as severe coronary artery disease, alcoholism, thyroid disease, diabetes, and viral infections of the heart. If you have a family history of coronary artery disease, thyroid disease, or diabetes, it may be a huge contributing factor. Also, lifestyle factors contribute more than expected, like whether or not you have a high alcohol intake. Because genetic or family history of the disease is a possible cause, genetic testing is available to identify abnormal genes. It can also occur in women after childbirth. Investigations on the relationship of environmental factors and dilated cardiomyopathy are scarce. Although analyses have shown significantly increased risk for lower education or socioeconomic status, smoking or passive smoking in a workplace, and prior bacterial infection caused by inhalants or pollution. A doctor will typically listen to the heart for any arrhythmias or heart murmurs that would indicate any sort of irregularity. Chest X-ray can help check the size of the heart and lungs and show if there is any fluid present in or around the lungs. Echocardiogram, however, is the primary way of diagnosing a cardiomyopathy. It uses sound waves to produce images of the heart, allowing the doctor to see if the left ventricle is enlarged. This test can also reveal how much blood is ejected from the heart with each beat, and whether blood is flowing in the right direction. An exercise stress test in which electrodes are attached to you helps the doctor monitor the heart's rate and oxygen use. The test can show the severity of problems caused by dilated cardiomyopathy. If you're unable to exercise, you may be given medication to create stress on your heart. Treatment aims to control and slow the progression of symptoms, as well as to prevent sudden death. Treatment should begin with fixing the underlying cause of DCM, if there is one that can be diagnosed. This could mean a range of things from avoiding drugs like cocaine and alcohol to treating endocrine disorders like diabetes or thyroid disease. In some cases, the cause is idiopathic, meaning doctors cannot find a cause. A good starting point in treating DCM is to adopt a healthier lifestyle, exercise regularly, eat a healthy diet, and avoid alcohol and drugs. Depending on your symptoms, a doctor may prescribe a medication or a combination of medications. For example, vasodilators will dilate blood vessels and lower blood pressure. Beta blockers slow the heart rate and lower blood pressure. Diuretics cause the body to excrete excess fluids, include fluid in the lungs, making breathing easier, and blood thinners help prevent blood from clotting. A doctor may also choose to place a permanent device called an implantable cardioverter defibrillator, also known as ICD. ICDs work by delivering electrical impulses to the heart when an abnormal or rapid heartbeat is detected, helping to prevent the heart from failing or stopping. If medications and implants are not effective, a patient with DCM may be considered a candidate for a heart transplant. When treated properly, dilated cardiomyopathy can be a very manageable disease.